159.
Hello. Okay. Yeah, we are live now, ma'am. So we can start. 5, 4, 3, 2, 1. We can start, ma'am. Ma'am, mic muted.
Good afternoon, everybody. Welcome to this first webinar of IMA Noida. We are very, very happy to be connected with you all. And we have a very interesting program which has been planned for today for next 1.5 hours. So we are very happy to say that we have our National President of IMA, Dr. Rajan Sharma with us. We also have the UP President and Secretary with us. And of course, you have your own Noida team, Noida IMA President, Secretary and Treasurer. And so we will have an interesting discussion of question answers. The protocol will be, the order will be that first there will be 3 messages, 4 messages by the dignitaries, and this will be followed by a question answer session. So you can post your questions on your screen, and we will take up those questions one by one. And after this, there will be 3 talks related to COVID. One on telemedicine, one on what your workflow should be, and one on treatment of COVID. So we get started. First and foremost, I would like to thank Dr. Rajan Sharma, our IMA National President, for being with us, and I would like to invite him for giving his message to all of us.
Thank you, Dr. Mohita, and good afternoon, everybody. So it is a welcome move. Maybe I would not have had the opportunity, or we would have the opportunity of interacting on such a big level when we are just across the border in Delhi and Noida. And but Zoom and webinars have proved to be a boon to overcome our loneliness also, and our busy schedules have taken a break, and also has given us a lot of time to rest, recapitulate, rejuvenate, and introspect, I hope. So friends, as you are aware, when COVID struck, nobody in the world was prepared for it, including us. Whereas all the so-called developed Western powers just raised their hands up that we could not do many things. We started in the right earnest. By we, I mean the government, the Prime Minister, the government, and IMA as a body. We started because IMA, if you all know, as you all know, has a legacy with the independence movement of India. Formation of IMA goes back to way back to more than before even 1931. And our association of disagreement with the British Medical Association. Before independence, we were part of the British Medical Association. So in 1951, we got dissociated from the British Medical Association and became Indian Medical Association. So keeping that in mind, there was no stock of PPE kits, and the entire world was dependent on China. So there was a big discussion going in our international group. So WMA president, World Medical Association president, told in one of the webinars, this crisis has taught us healthcare is an investment, not a cost-cutting procedure. And this is so very true that in India, I would be very frank enough to admit, the gross neglect of the healthcare for the public successively, and that discrepancy and that void has been filled by all of us. We have done our studies, come out, joined a civil hospital or joined a job, got into setups, rented accommodation, have risen up the way, struggling, taking loans, repaying them, and again retaking loans, and it must be in the process of repaying them again. But we filled that void. Just imagine a scenario when this strength of the country, the single and the couple doctor setups is not there. But today COVID has brought our profession, our noble profession, back into the reckoning. And we were all disgusted and upset with what was happening to us in the pre-COVID era, various demands, violence, and other things. So when March 22 happened, the Prime Minister led the nation. It was a very nostalgic feeling that our entire neighborhood was clapping and ringing bells and all. So we felt nice that yes, and we forgot pre-COVID violence as a bad dream. But then the violence perpetuated on us all across the country was a big eye-opener. And that made us ponder that is the nation and the people not realizing? But as these incidents started happening, awareness campaigns started in the public. And when what happened in Chennai and in Shillong really shook us, because keeping our moral responsibility to the nation and our Hippocratic oath, which many might say might not be relevant, but still, I always say, whenever a question is asked by the media, Doctor, why do your strikes fail? I said they fail because the human side on the other side of the fence or the table does not let the human being in me die. And my profession teaches me only one thing. Even if there is a roadside injury, we will definitely stop and try to help him and take him, which might not be there anywhere. So all these things, when this episode of deaths and the dismembering of the bodies and the convoy to carry the bodies happened, a big grief came into mind as that why are people doing this? And all we yearn for, and that I've been telling all the leadership, is safety and security in our lifetime and dignity and honor in our death. Whether it is an insurance amount of 50 lakhs, we are so well off that nobody will of us would like for an insurance amount, die for an insurance amount of 50 lakhs. Our value cannot be calculated. If you just imagine the amount of lives we save and which only we can save, that value can never be calculated by anybody, any individual or any government. So keeping that in mind, but yes, we were working. We rose to the occasion. Our friends from the government sector and our private sector chipped in with providing technical inputs, physical inputs like ventilators, whatever was required. A lot of places in the country, even the PPE kits. So the nation rose as one. And we could never ever shy away from responsibility of that sort. But also to make people aware and the government to sit up and notice, we issued a white alert and a black observation of a black day by wearing black vests. But we would have kept working. That was the very clear intention of that. The objective which immediately started happening, the media, the police and the public were on one side with the doctors. I would not say I could do it because of the strength given by me to all of you. And these letters behind Madam, Mohita Madam, IMA, it includes the entire country's doctors. That gave me that strength to come on the national media. We were on the news everywhere, for we had caught the imagination of the country and the world. The world was looking at us the way we are behaving responsibly, and immediately the government responded. And within less than 12 hours, The health minister called me. Why I am saying this? As I represent you, I owe an explanation to you of the way of things. Many of you might not be aware, or you would not have read the detailed letters written by me. So the health minister called me that the home minister wants to have a VC with you and the IMA leaders. So all across the country, we gathered a team of around 12 leaders. And next day morning, 9 o'clock, we had a VC with the Honorable Home Minister. Where for 40 minutes, as a representative of you all, believe me, I might not respond much on WhatsApp, but I read each and every WhatsApp. And I record it and keep it for my knowledge. To be brought out, whether it was a FIR against a colleague in Panchkula, whether my friend in Ghaziabad who was facing some problems because of the executive order of no physician to treat fever, cough and sore throat, or my colleagues in Madhya Pradesh, or the shortage of PP kits and other things. Everything was brought to the notice of everybody, especially in that meeting. The Home Minister conveyed the message of the Prime Minister that even one doctor, if he is not happy with the situation, is a matter of deep concern and worry for us. It is not a question of 10 lakh or 12 lakh doctors lighting a candle. Even one doctor lighting a candle is a setback for us, that we are doing not enough. These are difficult times, what your demand is, but I definitely will live up to it within a short span of time. And I promise your safety and security in the coming times also. Again, as you will all agree, keeping in mind the human profile of our work, strike has never been an option with us and has never succeeded. We took the call, and if as a leader I took the call to go and talk to the Home Minister, I realized strike was not an option. And in this hour of crisis, we cannot be seen betraying our people's public trust and the government. Because such an action would have highly antagonized the society in which we all live. Take it or leave it, we still are doxa. Commercial angles apart, violence, I have never been friends, I have never been subjected to violence. Many of you might not, but this was a concern deep down our DNA that this is wrong. I can tell you one thing with great pride, that as president of Haryana Medical Association, I got this Violence Act passed in Haryana, second state in the country. And I was the first president to start getting reliefs for Clinical Establishment Act, which ultimately resulted in 50 beds and below getting exempted. And as recent as Punjab got the same relief quoting our acts. So the path of negotiation, if was opened, the doors which are closed for so long have opened. This is, I am not claiming victory. I am just saying this is the first tender step taken towards the ultimate goal of an healthcare violence bill, central bill in the parliament. The ordinance also needs to be ratified by both houses of the parliament. And since the parliament is in recess, Act we will be working on the Act with the government. And I am sure, I cannot predict the future, that we will be definitely getting this Act. Also, Dr. Chopra and Jayant are here. We have our respective acts passed in the states. We all should gather our might. And at any political contact, any bureaucratic contact, anybody of you might have, please make it a point that like a table of two, you have to say, sir, incorporate these provisions of the Ordinance of Epidemic Act 2020 into our State Act. This can be done. I have already set in motion in our yesterday's President Secretary's meet. We should be done. Now, another case was, another apprehension in our mind is, what if litigation happens and patient files a case against us that I have got COVID because I visited this hospital? Nothing more can be said that how to prove that COVID has happened from this hospital. Another, any act of good faith during an epidemic is totally free from litigation. Under the Epidemic Act, in a page of 1.5 pages, our rights are fully protected. Now coming to the point that COVID and non-COVID. We just had a meeting with our district administration, and the first thing this question was, sir, what about COVID or non-COVID? He said, sir, every IMA doctor has given us that understanding that they will be working with us whenever they are required. So you are all on COVID duty. This is the first time the onus of getting this act, this allegation proved or innocence proof is on the patient and not on the doctor. So that will take care of the cross cases. Whatever the punishment clause is there, compensation clause is there. Now we start our campaign again. While we do this, we have to realize, friends, this is the golden moment for us to reclaim our lost glory. Today, never ever before, everybody is looking at us. We just have to seize that opportunity and live up to their expectations and come up with full cooperation. Last but not the least, please take care of yourself, take care of precautions, and there are certain myths about PPE kits that need to be understood by you. Always with you, always there for you at IMA. Thank you so much. Now, any questions or anything? Yes, please.
Thank you, sir. We'll take up the question answers later on, sir. Sir, Dr. Ashok, try to please enlighten us with your words, sir.
Yeah.
Thank you.
Thank you. Hello, am I audible?
Yes, sir.
Audible and visible.
Yes.
Okay. Okay, sir. Good afternoon, sir.
Good afternoon, Dr. Shobhra.
Honorable National President of prestigious Indian Medical Association, Dr. Rajan Sharma ji, Secretary of Indian Medical Association, UP State, Dr. Jain Sharma, President of IMA Noida, which is a vibrant branch of IMA UP State, Dr. NK Sharma, Secretary of IMA Noida, Dr. Mohita Sharma, and all dear friends. First of all, I welcome you all on behalf of Indian Medical Association UP State. I welcome our National President, Dr. Rajan Sharma, in this meeting, who has spared his valuable time to attend our all meetings of IMA Uttar Pradesh. So really, IMA Uttar Pradesh is blessed with the blessing of Dr. Rajan Sharma. Dear friends, first of all, I feel proud to be a member of this prestigious organization. For the first time in the history, we are getting recognition by the state and even by officials. I hereby congratulate on behalf of IMA UP State to our National President, Dr. Rajan Sharma ji, for this great achievement. I was fortunate to be a part of the video conferencing which was held with Honorable Home Minister Sri Amit Shah ji. I was really impressed to see the way the ministers, Secretary Health, and everybody appreciated the efforts of Indian Medical Association. Our president spoke very well on all the issues related to all the medical problems are related to us. So friends, on behalf of IMA UP State, once again I congratulate our president Dr. Rajan R.V. Ashokan and all the national leaders and even our state leaders also. Friends, IMA UP State is very much committed for COVID issues. We all are with the government, and our all branches are doing whatever possible way to help the government. Our team is ready, whole team is ready of IMA Uttar Pradesh. Almost 1600 members volunteered for the service in IMA Uttar Pradesh. Few things I want to tell you, that your registration date has been extended up to 30th June, as you are aware.
Very nice.
Secondly, regarding the OPD issues, IMA UP has issued the guidelines that you can do your limited OPDs, but in our efforts is doctor's protection first. You take all the protections and then see the OPD. Regarding emergency in Uttar Pradesh, you have to take the permission from the Chief Medical Officer and District Magistrate regarding running the emergencies if you are admitting the patient in emergencies. So dear friends, I will not take much time. I'm really thankful to IMA Noida for inviting me to this prestigious video webinar. And thank you very much once again, Dr. Mohita, Dr. N.K. Sharma, and I'm really thankful to our National President for attending this webinar. Thank you very much.
Thank you so much, sir. And now I would request our IMA UP Secretary, Dr. Jayan Sharma, to give a message to the audience.
Good afternoon, everybody. Dr. Rajan Sharma, namaskar.
Namaskar.
Nice to see Dr. Rajan Sharma's glowing face all the time. And he has, I think, lost some.
उत्तम प्रदेश में टाइम बीत रहा मेरा.
Yes. आप उत्तम प्रदेश में हमारे साथ बने रहिए और चीजें भी उत्तम होंगी सर. I wanted to inform you about some incidences, as Dr. Ashok Rai is also aware. There was one incident happened day before yesterday in Ayodhya. So Dr. Rajan Sharma, I need your attention. It was same pattern and same modus operandi is happening everywhere. Like one patient came to one hospital. Hospital was owned by internist. He's an anesthetist and he's running his OPD as well. And when patient came, as instructions given by government, doctor did everything according to recent guidelines. He sent COVID test also, and patient went home. After 2 days, COVID test becomes positive. Doctor himself sent test. They contacted authority. He informed authorities also. Then authorities started tracing this patient's whereabouts. And then they started allegating doctor that you are not keeping your records, you are hiding facts and not keeping your records. And FIR was lodged. Sir, this was very disheartening. Yesterday they had a big gathering and they did not want to work. Then I advised them to go and meet the district magistrate. 3 people went. They said FIR तो already हो चुकी है डॉक्टर साहब, अब इसमें आगे जो जांच होगी तो उससे देखेंगे. सर, डॉक्टर राजन शर्मा सर, इसमें आपका क्या व्यू है और इसमें आगे मुझे या डॉक्टर अशोक राय साहब को अपने मेंबर्स को कैसे कंसोल करना है और उन्हें क्या गाइड करें, क्योंकि ये बड़ी सिचुएशन खराब हो जाती है, हम काम भी बंद नहीं कर सकते. आप थोड़ा सा गाइड करें इसके. और हम एक लेटर आज एक ड्राफ्ट कर रहे हैं, मैं आपको इन्फॉर्म कर दूं सर चीफ मिनिस्टर के लिए.
Jayant, you don't need to console. It is bloody nonsense what has happened. Has somebody got written on his face that he is COVID positive?
Your voice is not.
I said, hello. Am I
We
audible?
can hear.
Hello.
Yes, we can hear.
Yes, sir. Yes, sir. Yes, sir.
You don't need to console the doctor. You have to condemn it fully and take strongly worded letter. Don't write a letter like you are writing for a school application. One incident happened in Panchkula. My branch president was trying to talk, but I made it a national issue. Now, since the Home Minister also knows, Ashok Rai was part of the meeting where I said FIR being lost. See, tomorrow, 3rd May, once everything opens up, these patients are going to walk into X-ray clinics, walk into eye clinics. Will you start filing FIRs against everybody? That is why I have already demanded that one nation, one set of guidelines. Please write a letter to the Chief Minister immediately condemning the incident and demanding for one set of guidelines. Send a copy to me. I will do the needful at the center. But we will not take this line down. Plus, friends, a simple advice. Any patient who turns positive, don't send him home, please. Immediately call. That was one of the questions asked and I was coming. Immediately please inform and keep some, I will share it when the question Dr. Mohita had sent me to answer that, but I will answer it now. What we have done here is we have formed a WhatsApp group. And at the end of the day, anybody who sees such patients uploads a Google form for the civil surgeon office. Now the trend is that civil surgeon office says, "Arey boss, you are uploading everything."
Obviously.
So that is the way. And as I say, 3rd May, I don't know UP will open up or not, we are opening up. COVID will stay for some time or whatever time, I don't know. Our practice, these factors have to be factored in. Here what is happening is everybody is having an independent approach. We have become the targets, that's what I was saying. And also, has the nodal officer been appointed for Noida, this Ayodhya? Have they done it in UP or not?
Dr. Jain?
What, sir?
The Ministry of Home Affairs letter to all the chief secretaries and DGPs to form nodal officers from the police and the district administration in every district and town.
Yeah, they are formed.
So who is the nodal officer for Ayodhya?
Ajodhya, we'll see, sir. We'll see who is the nodal officer.
Immediately, Dr. Shokrai and Jain, call him up.
Yeah, sure.
Give him an official letter of condemnation.
Yeah.
And send a copy to the Chief Minister. Send a letter to the Chief Minister with a copy to the District Magistrate and CMO. See, some things, once you display no-nonsense approach, you will see the difference happening within a few days.
Okay, we'll do it today only.
Please.
Okay, Dr. Jain, you wanted to say anything more in the message, or should we go on to the next to Dr. N.K. Sharma for his message?
We will. You continue. We will.
Then we will.
Yeah, we'll talk to each other.
Ask Dr. N.K. Sharma to give his message, and then we will go on for the question-answer session. Right?
Yeah, sure.
Dr. N.K. Sharma, please. Our IMA Noida president, do you want to give a...
Dr. NK, I'm sorry, I didn't know. Protocol demands that I should address state president, state secretary, then the local branch president, and then local secretary. So that is the protocol. I'm sorry, I didn't know. I realized my mistake after my talk.
Right.
No problem.
Boss always is right, sir.
No, boss. Here, boss is wrong. So that is why he's taking the policy.
Right. हाँ मोहिता बोलो.
Yes, Dr. NK, please.
देखिए, on behalf of IMA President Noida, मैं आज अपने राष्ट्रीय IMA के अध्यक्ष शर्मा जी, हमारे अशोक राय जी जो हमारे प्रदेश के अध्यक्ष जी हैं, और जैन शर्मा जी, मैं आप सभी का बहुत हार्दिक धन्यवाद करता हूं, आपका आभार भी व्यक्त करता हूं और आप आपका स्वागत करता हूं नोएडा में। और सबसे ज्यादा मैं कहीं इस बात में आज मुझे कोई इसमें संकोच नहीं है। हमारे जनरल सेक्रेटरी जो मोहिता शर्मा ने जो एक इनिशिएटिव लिया, जो मेरे दिमाग में ये बात डाली कि सर ये हमें करना चाहिए, तो मैं बहुत शुक्रगुजार हूँ कि इन्होंने इस तरफ हम लोगों को जागरूक किया। आप सब लोग इंग्लिश में बोले थे, मैंने सोचा थोड़ा सा हिंदी में बोल दूं, कुछ लोग बात वो भी आ जाएंगे। और अपने आदरणीय डॉक्टर महेश शर्मा जी जो हमारे सांसद महोदय हैं यहाँ पर, उनका बहुत आभारी हूँ। और यहाँ की जो हमारी नोएडा प्राधिकरण की सीईओ रितु महेश्वरी जी, हम उन लोगों से सबसे चर्चा करने के बाद हमने ये वेब इसका जो आज वेबिनार के विषय में हम लोगों ने जो किया है, उसी का एक प्रतिफल है। आप सभी ने अपना कीमती समय निकाला और हम लोगों को आपका मार्गदर्शन आपका प्राप्त होगा। और पूरे प्रदेश को ही नहीं, पूरे देश को आज बहुत सारी ऐसी जानकारी हम लोगों को मिलेगी आपके माध्यम से, जो डे बाय डे हम डॉक्टर्स की काफी समस्याएं हैं। हम लोग तो चलो फिर भी ऐसी जगह है यहाँ पर सब चीजें इजीली हम लोग कर लेते हैं। बहुत सारे हमारे ऐसे फ्रेंड्स हैं जिनको सुविधाएं बहुत कम है। दूर दराज देहात में हमारे बहुत सारे फ्रेंड्स ऐसे डॉक्टर्स आती हैं जहाँ कोविड के नाम पर या और दूसरी चीजों के नाम पर प्रशासन का प्रताड़ना भी बहुत सारा कुछ झेलना पड़ रहा है। तो ऐसी स्थिति में हम समझते हैं कि आज ये जो वेबिनार के माध्यम से हम काफी अपने डॉक्टर फ्रेंड्स को हम जागरूक कर सकते हैं और इसमें आप सब लोगों का योगदान है। मैं पुनः आप सभी का बहुत बहुत हृदय की गहराई से स्वागत करता हूँ और आपका धन्यवाद करता हूँ।
Thank you so much, Dr. N.K. Sharma. And now we will go on to our question answer session. So we have already some questions which are posted by our members. So I will put them across one by one, and some are coming now also. So for the next 30 minutes, we will answer all questions. So anybody who wants to put up their questions, they can write their questions, and we have a link with which we will get them. So the first question which has been coming again and again, Dr. Rajan Sharma, we wanted to ask you this, is that if there is an emergency patient, for example, there is a patient of delivery or MI or trauma.
मैंने लिखा हुआ है.
For the COVID test, yeah.
मैंने लिखा हुआ है. I have noted down the questions from your group. See, frankly telling you, a lot of confusion is there at the moment. But we also realize we have to bounce back and start working. हमें काम करना है और करना चाहिए. ये arbitrary guidelines नहीं चलेंगी. Like normal delivery cannot wait. COVID testing labs are already feeling the pinch of too many numbers. Kits जो आई हैं, they are also not proved to be dependable. So if you go to your district COVID lab, he will not be able to give you a test, and a labor patient in labor cannot wait. And you cannot send everybody to a civil hospital or a COVID hospital. You have to realize this. Emergency delivery sections, any other section, any trauma case, we have to deal with the emergency. And considering that everybody is positive, personal safety is most important. We are shortly coming out with certified PPE courses, these guidelines and sources, where you must use these PPE kits. The same thing happened when HIV came. The only thing to prevent in this case is droplet contamination and also some modulations. But emergency cases, discuss these things here. You have Dr. Mahesh Sharma here, but discuss, please. Let me be very clear. This is a moment of glory for IMA. Raise your voice on pertinent issues with the district administration. They don't have any other alternative than to listen to us.
Yes.
Please be that voice.
True, sir. So to summarize, we should be doing the emergency cases, considering that every case is COVID positive. We take it as a positive case and do the case, and the report can come later, and accordingly the precautions can be taken.
No, you can inform that I have done a cesarean section on a delivery case. Yes. The sample has been sent. Report is awaited. See, learn to just create a document.
Yes.
Our administration said, okay, you send a WhatsApp. I said, create evidence.
Document.
I told my branch president, start sending a consolidated email in the evening, but he came with a better idea. Most of us are literate with Google Forms, though I am not. But yes, everybody has a staff. So Google Forms started getting uploaded. Now they know that even cough and fever is being reported to them. They are now coming here, boss, ye to bahut zyada ho raha hai, how to manage. So information is very important.
Sir, if we are wearing we are taking all precautions, wearing PPE kits, etc., doing the procedure, and later on, if the patient comes out as positive, then would we be sent to quarantine or would we not be sent to quarantine? Because that's the biggest fear in doctor's mind, that later me and my whole staff would go into quarantine.
See, Dr. Mohita, the first thing is the entire world, including India, was not prepared for it. Everybody is framing their own guidelines without realizing things. Now, like it is, you have seen in Meerut, the hospitals are being sealed. There was a scare in Max Vaishali, the hospital was being sealed. So, we are already lacking in these facilities. You cannot end up closing the entire hospitals. You will have to end up closing that wing, that also not sealing. These guidelines are already being followed in Southeast Asia, Singapore, Hong Kong. And the document which we have prepared, post-lockdown protocols and including finding positive patients in your OPD, is they just immediately, if the patient is positive, they inform the public health authorities. They come, they decontaminate, they do deep cleaning and surface disinfection, and the next day the clinic is open. Same is for hospital that wing. But now there are a lot of people coming in with these measures, and fumigator was a good alternate initial this thing, but now they have come with aerosol therapy for that also. Also, it is pertinent to mention here, we will have to go for an alternative plan for air conditioning, because contamination is by the aerosol spread. Maximum spread has occurred through the airports also. So I think 1st May or so, we are organizing a webinar which will be streamed live on Facebook on air conditioning and its relevance vis-a-vis healthcare. Central air conditioning, because we might need to, we will be ending up the role of humidifiers, the temperature between this degree and this degree, and filters might be changed, and also air circulation has to be introduced. So these are the few factors. And I will be sending the links to all the state presidents and secretaries. Anybody interested can attend. Yes, ma'am.
Okay, thank you. Dr. Jain, I wanted one question from you. Today, one of our members posted and wanted this question to be answered. There was a news in Navbharat Time which said that private hospitals are spreading infection, and private hospitals, if a positive patient is found to be COVID positive, then the hospital has to be sealed. So obviously, this news has been wrongly written. We are not sure, because this is what they said, and they named the chief minister for this. So we don't think government would have come up with this. So we wanted to if you had any idea about this.
Yes, very well, ma'am. It is absolutely nonsense that private hospitals are spreading these kind of infections. A incident I am telling of Aligarh. Here in Aligarh Medical College has become a hot spot for these COVID patients. Those patients, those who are going there or they have stopped taking OPDs and all those things, those who are coming back to different hospitals are becoming COVID positive. They are going to Bulandshahr, they are going to different cities, as people are not taking them in Aligarh. So, and all cases, all 17 cases have somehow some connection with JNMC. So I don't think. So I don't think it is right to allegate private hospitals. If a symptomatic patient is coming to any doctor, medical college, civil hospital, or private hospital, it can be a potential case of COVID, and you don't know.
So we can
So,
ignore the news for now.
Wrong allegation is right to allegate.
Okay. Okay, Dr. N.K. Sharma, one of our members wants to know, in fact, many of them want to know that we have been allowed, doctors have been allowed passes for going across Delhi and Noida, but the paramedical staff has not been allowed passes. So how do we function?
अरे यार
डॉक्टर एनके आपसे पूछा जा रहा है.
हाँ
इसका जवाब मैं दे सकता हूँ.
ठीक है सर, जवाब देंगे तो बहुत अच्छी बात.
Unknown to all of you, I was approached by one of the patients and one of the clinics in Delhi. A patient was posted for renal transplant and the doctor was to come from Noida.
Okay.
So his transplant got cancelled, and then after the patient, the hospital also approached me. Then I came to know this genuine problem. And rather at headquarters, we are facing problems because 3 or 4 of our staff are staying in Noida. So I had written a letter to the Chief Secretary of UP that many of our healthcare professionals and doctors and healthcare professionals have been living across the border and working in Delhi and staying in Noida or vice versa. And many doctors are visiting multiple hospitals. So this discrepancy should be corrected immediately. And the day I had written that, the next day only they had done it. Those orders must be officially there, because I was reading on NDTV that there was a coordination meeting with Delhi police and UP police, Noida district administration, and this has been resolved.
Okay. Yes.
And the same has been done for Haryana also.
Yes. Thank you so much.
NCR should be exempted.
We have done.
But the question was also related to paramedical staff. Dr. N.K. आप कुछ कहना चाहेंगे इसके बारे में?
जो हम लोगों की डीएम साहब से बात हुई और सीएमओ साहब से जो बात हुआ था हम लोगों का, आप भी उस मीटिंग में थे, और डीएम साहब का मानना ये था कि शायद गवर्नमेंट से ही कोई इंस्ट्रक्शंस आए थे कि नोएडा के अंदर जो नंबर ऑफ द पेशेंट जो कोविड के थे वो बहुत ज्यादा हो गए थे और इसको कंट्रोल करना बहुत आवश्यक था. तो एक सीमा को सील करने की बात आई थी कि नोएडा की जो बॉर्डर्स है, चाहे वो दिल्ली से लगता हुआ है, फरीदाबाद से लगता हुआ है, गाजियाबाद से लगता हुआ है, बुलंदशहर से लगता हुआ है, कुछ एरिया कुछ हापुड़ से भी लगता हुआ उधर साइड में आता है, तो वो बॉर्डर्स को सील करना बहुत आवश्यक हो गया था. क्योंकि दिल्ली का जो बहुत सारे ऐसे लोग हैं जो लाखों लोग जो है नोएडा में और दिल्ली में दिल्ली का आना जाना रहता है. बहुत सारे ऐसे लोग भी हम देखने को मिले, क्योंकि 700-800 लोगों के जब हम लोगों ने सब शुरू किया था IMA नोएडा ने कि सीएमओ और डीएम साहब से बात करने के बाद कि पासेस की इशू कराने के लिए, तो लगभग 850 यानी कि 850 के आसपास हम लोगों को मैसेज आ गए थे कि हमारे पास की आवश्यकता है. और वो कंपाइल होकर के वो लिस्ट सीएमओ साहब ने पुलिस कमिश्नर के पास भेजी, तो उनका फोन मुझे आया कि डॉक्टर साहब क्या 850 के आसपास आपके डॉक्टर्स नोएडा से दिल्ली में जाते हैं या दिल्ली से नोएडा में आते हैं? ये एक बड़ा क्वेश्चन था कि आपके यहाँ IMA के आखिरकार मेंबर्स कितने हैं. उन्होंने जब मेरे से ये पूछा कि आपके यहाँ मेंबर कितने IMA के, तो 850 तो आपके डॉक्टर ही डॉक्टर हो गए. पैरामेडिकल स्टाफ और अलग से जब हो जाएगा तो ये आपकी राउंड फिगर 2-3,000 के आसपास पहुंचेगी जाकर. तो इन सारी कंडीशंस को देखते हुए उसका जो मोटिव था, जो सील करने का मोटिव था, वो बिल्कुल उसमें काम नहीं बनेगा, क्योंकि हर डॉक्टर के साथ में ड्राइवर शुरू हो पाएगा. तो लगभग ये 6-7 हजार आदमी जो है पर डे का आना जाना हो जाएगा. तो बहुत एक पैनिक वाली स्थिति बनेगी और लॉकडाउन का कोई मायने नहीं रह जाता फिर. तो इन सब चीजों को ध्यान में रखते हुए डीएम साहब ने एक डिसीजन लिया था कि जो हॉस्पिटल्स के जितना भी हॉस्पिटल का स्टाफ है जो अपने यहाँ है उनको नोएडा में ही स्टे किया जाए. जो दिल्ली के जो स्टाफ है या फरीदाबाद से जो आ रहा है उनको कुछ ऐसी व्यवस्था की जाए ताकि वो नोएडा में रहे और सीमा से बाहर ना जाए और वहीं वो अपनी ड्यूटी करते रहे. कोई कहीं उनके लिए हॉस्टल की व्यवस्था करके या अस्पताल कुछ तरीके से इस तरह करने के बाद में, ताकि वो पासेस की जो समस्या थी पैरामेडिकल स्टाफ्स की वो भी कवर कर सकते थे. लेकिन कुछ लोगों का ये भी था कि वो जो प्रॉपरली नोएडा में उसमें जो गाइडलाइन आई थी सर को बहुत अच्छी तरीके से मालूम होगा कि जिन डॉक्टर्स की ड्यूटी कोविड में लगी हुई है या जिन पैरामेडिकल्स की जो ड्यूटियां जो कोविड में ड्यूटी कर रही है पास केवल उनके लिए अलाउ किया जाए, क्योंकि ये भी एक इशू था। मेरा मानना यह है बिल्कुल डिसीजन था गवर्नमेंट का, क्योंकि हम आज इस समय में हम केंद्र सरकार और भारत सरकार के साथ में जो भारत सरकार हमारी, केंद्र सरकार जो हमारी है, राज्य सरकार जो हमारी है, हम उसके हर तरीके से IMA नोएडा भी और हमारा पूरा उत्तर प्रदेश और हमारी नेशनल IMA उनके साथ में है, कंधे से कंधा मिला करके हम उसके साथ में है, ताकि जो है इसको जो भी साधन हम जुटा सकते हैं COVID-19 को कवर करने के लिए, चाहे वो कम से कम पासेस इशू करके या और किसी तरह की बॉन्डेशंस करके तो हमें उसमें करना चाहिए। मैं समझता हूँ गवर्नमेंट ने जो थोड़ी सख्ताई करी है प्रोसेस के विषय में, कोई ठीक उनका कदम है, मैं इसके पक्ष में हूँ, इसके खिलाफ नहीं।
ठीक है, थैंक यू डॉक्टर NK। डॉक्टर अशोक राय, आपसे we wanted to ask one question. Many members are asking that now that there is a capping on the price for COVID test, many of the private labs are refusing to do it, and government में तो वैसे ही overloaded है, so how do we go about it?
Actually, the price in the, if you see in the private labs, it is approximately 4,500.
Yes.
What they are claiming that our kit is cost around 3,500. We have written to the government, and it is now government has replied that it will cost 2,500 for the Ayushman patient, and that for Ayushman patient government will pay to the lab, directly to the lab. But for non-Ayushman patients, the patient has to pay that amount to the lab. If it is necessary that suppose if you are doing a operation for LSCS and you are sending a to PET kind or LOL PET, they will charge you 4,500. Government will reimburse only to the Ayushman patient, not to the other patients. We'll write to the government what we have planned, that we'll write to the government that this cost should be reduced to around 3,000, because in the government setup, government is paying 2,500 to the labs for Ayushman patient. We want the same price for our private patients also.
Thank you, sir. Dr. Rajan, you have to say anything in this?
डॉक्टर मोहिता,
हाँ जी, हाँ डॉक्टर
एक बड़ा लोगों का कंसर्न था,
हाँ,
ये मैं सवाल डॉक्टर अशोक राय सर से भी डॉक्टर राजन से भी पूछना चाहूंगा। बहुत सारे ये गवर्नमेंट ने जो अलाउ किया है कि खाली इमरजेंसी अलाउड है, ये डिस्ट्रीब्यूट करना कि कोई पेशेंट अगर वॉक इन है हॉस्पिटल में कि वो इमरजेंसी है या नॉर्मल OPD है, ये बहुत डिफिकल्ट है। डॉक्टर्स का सबको ये कंसर्न है, पेशेंट आता है और अगर कोई माइल्ड पेन इन एब्डोमेन है या उसको किसी तरीके से सम काइंड ऑफ ब्लीडिंग PV या कुछ है। अभी जैसे मैं अभी बीच में फोन आ रहा था अटेंड कर यहाँ के विधायक का कि उनके कोई रिलेटिव है, उसका 2.5 मंथ प्रेगनेंसी थी, अब मिसकैरेज हो गया या क्या हो गया, ब्लीडिंग हो रही है। तो ये कैसे डिसाइड करना है, ये सबसे मुसीबत है और कंसर्न भी लोगों का यही है। और क्या इस ऐसे पेशेंट को सबको कोविड मान के वी हैव टू सेंड रिपोर्ट्स टेस्ट फॉर कोविड टू अशोक राय सर, आप कुछ
देखिए, अगर कोई भी पेशेंट, जो गवर्नमेंट की गाइडलाइंस है, गवर्नमेंट की गाइडलाइंस बड़ी स्पष्ट गाइडलाइंस नहीं है। जो भी गाइडलाइंस कहती है कि आपको इमरजेंसी देखना है, PD भी आप देख सकते हैं, लेकिन राइनोरिया एंड कफ के पेशेंट्स नहीं देखते हैं। यू हैव नॉट टू सी एनी पेशेंट व्हिच आर प्रेजेंटिंग लाइक ए अपर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन सिम्पटम्स एंड लोअर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन। So the problem is, if the emergency related to the gynae cases, you are definitely allowed. Emergency related to ortho cases, you are definitely allowed. Emergency related to cancer patients, you are allowed. So all the emergencies are allowed, but one thing is sure, that if you are suspecting COVID, send the test, check the blood, send for COVID test, and if COVID test becomes positive, you inform to the government, and if you can treat them, it's okay. Otherwise, you shift to the hospital. This is the guideline.
Sir, with me, our editor, you are director CGP, Dr. Alok Kulshrestha. He was previously.
Dr. Alok, please.
सर नमस्कार, डॉक्टर राजन शर्मा नमस्कार।
प्रणाम।
अशोक सर नमस्कार।
नमस्कार सर, नमस्कार, बताइए आलोक जी।
एक सवाल मुझे, नमस्कार सर, मुझे ये पूछना था कि जो हमारे डिस्ट्रिक्ट के पेशेंट हैं उनको तो हम ले रहे हैं, लेकिन जो आउटसाइड डिस्ट्रिक्ट पेशेंट हैं क्या हम उन्हें ले सकते हैं इवन इफ दे आर नॉट हैविंग अपर रेस्पिरेटरी और लोअर रेस्पिरेटरी ट्रैक्ट इन्फेक्शंस?
नहीं, इमरजेंसी केसेस के लिए किसी ने मना नहीं किया सर। इमरजेंसी केसेस आप ले सकते हैं, लेकिन आपको श्योर होना कि कोविड नहीं है। अगर कोविड है तुरंत गवर्नमेंट को इन्फॉर्म करिए। सबसे बड़ी प्रॉब्लम है कि आपको पता नहीं लगेगा कोविड है कि नहीं है, तो आपको उसका टेस्ट भेजना पड़ेगा अगर थोड़ा भी सस्पिशन आपके दिमाग में है तो।
लेकिन सर अगर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन,
डिटेल हिस्ट्री आपको लेनी है, हिस्ट्री आपकी बहुत डिटेल हिस्ट्री लेनी है। उसके 8-10 पॉइंट्स जो हैं वो हिस्ट्री आप अपने पैरामेडिकल से कहिए कि पूरी हिस्ट्री ले ले और उसके बाद ही आपके पास भेजे।
और सर यहाँ हमारे डीएम के जो इंस्ट्रक्शंस थे उन्होंने बिल्कुल क्लियर कट ये कहा हुआ है कि आप आउटसाइड द डिस्ट्रिक्ट कोई पेशेंट ना लें, और जो भी हॉट स्पॉट है इनसाइड द डिस्ट्रिक्ट वहां से आप कोई पेशेंट ना लें। सर हॉट स्पॉट से तो नहीं ले रहे हैं, लेकिन अगर डीएम के इंस्ट्रक्शंस हैं कि आउटसाइड द डिस्ट्रिक्ट नहीं लेना है तो
अब वो सुबह से लेके शाम तक
ऐसा कोई इंस्ट्रक्शन प्रदेश सरकार की तरफ से नहीं है। ये एक लाइन का लिख के आप भेज दें, मैं प्रदेश सरकार से पूछ लेता हूँ। वैसे प्रदेश सरकार की तरफ से ऐसा कोई इंस्ट्रक्शन नहीं।
जी
So, sir, the next question was, Dr. Rajan, I think you had already answered. If there is an FIR against a doctor or a hospital, then what should be the next course of action? So I think
See, under the Epidemic Act, we have got full protection.
full protection. Okay.
Please, Epidemic Act is only of 1.5 page. Read it.
Okay.
Any act of goodwill done in duty towards the epidemic will not be liable legally. And same is true for WhatsApp groups messages that you take consent that this COVID, I will not hold the hospital responsible for COVID. Let me be very clear, I have extensively sought legal opinion also, just to allay the fears. To prove that COVID happened to me here or outside or anywhere is impossible. And we have got full legal immunity against this. Another question which I would like to address is COVID and non-COVID. As Dr. Shokrai, Jayant and all of you have agreed that we have supplied our list of doctors, specialists, specialty-wise to the civil administration, including pledging our bed strength and our ventilators. So technically and practically, we are all on COVID duty, maybe today or tomorrow or later. First line, second line, third line, we all have to be prepared, but we are totally covered under this immunity of epidemic amendment. Till the time we are normal, see all these emergencies, don't take this district, don't take this district. Why sometime we have to come back and get back to our routine. But yes, opening up hand washing centers outside your clinics, putting, as Dr. Shokrai said, screening outside with a 10-point answer questionnaire, thermal scanners have to be a new norm. Overcrowding in small clinics and not maintaining physical distance of 2 meters is not possible now. We will have, as I said earlier, we will have to undergo a big change in our practice patterns. And yes, the cost of consultations that will also increase, which is to be passed on. PPE kits, the original PPE kits are the hazmat suits. For routine, you can just wear a surgical mask in OPD with gloves and a disposable gown and a simple visor. A visor is such a cheap and best investment that it completely shields you from any droplet infection, contamination. So, litigation wise, you are very well protected under this Epidemic Act. Don't have any questions or any doubts in that. Whereas these district happenings are concerned, every officer is taking a approach like I've already requested, I've already informed the Health Ministry and the Home Ministry, one nation, one set of guidelines. And shortly we are coming with the guidelines to run your OPDs and hospitals and how the hospital should function, because blood donation has suffered, onco surgery has been delayed. Then all these things have to come back. TB is suffering, the biggest killer. TB is suffering, general OPDs are functioning are suffering.
Not be able to give medicines.
And other medicines, I am an orthopedic surgeon, but I am not getting many patients, but yes, ENT, I think this under this garb of cough, you might detect more TB cases also.
Exactly.
Thank you.
सर डॉक्टर राजन शर्मा सर.
जी सर.
हाँ, एक क्वेश्चन मेरा है कि अभी जो हमारे यहाँ चीफ मिनिस्टर ने एक स्टेटमेंट दिया है, आई एम नॉट श्योर वेदर ही हैज गिवन आन नव भारत टाइम्स में आया है, दैट स्टेटमेंट इज कि प्राइवेट क्लिनिक, जो अभी डॉक्टर जयंत शर्मा ने जिसका आंसर दिया, डॉक्टर मोहिता ने पूछा, प्राइवेट क्लिनिक्स आर स्प्रेडिंग इन्फेक्शन, सो क्लोज द प्राइवेट हॉस्पिटल्स. इसके लिए क्या हमको लिखना है, योगी जी को क्या लिखा जाए?
Sir, don't believe social media or newspapers till you get an official notification.
Okay.
Because on that basis, only you can say. Many times it has happened, but then you are aware in many times that headquarters Jayant is aware.
Yeah, yeah.
Like that Niti Aayog statement. The Times of India stood by that statement.
Okay.
The better would be if you can get a verified version from Nav Bharat Times, which I am sure they will not do.
Okay.
And another thing is that I must inform the House, there was regarding the sealing of clinics. Am I right?
Yes.
In Gujarat, the government has passed an order that we will not seal the premises. The government tells the hospitals, limited sealing, decontamination has already been passed, and we will be shortly. We have already submitted one, and I've been bringing in this meetings. But now the guidelines, what I am talking about, these guidelines on sealing and de-sealing has to be done with it.
Sir,
and we are not soothsayers or astrologers that we can see the face that he is COVID positive.
Can you send the order to us, sir? Gujarat order? Can you send the Gujarat order to us so we can submit to our government?
It is again this thing, but it is authentic because the person who is there has sent it.
Yeah.
So I will just, there you go. Yes, I have sent it to you. You can see
okay.
it.
Sure.
Okay, thank you, sir.
Jayant and Dr. Mohita, I am sending it to you also.
Okay, thank you, sir.
NK Sharma, I don't have your number, so sorry.
We will.
We'll circulate it, sir.
Then there is, sir, one more question which one member has asked. Does IMA have any scientific committee which gives regular instructions or guidelines to all the doctor community to avoid any confusions?
Yeah, we have a scientific committee. That is why I said we are shortly coming out with the guidelines.
Right.
We are holding weekly webinars. This week, 1st of May is the webinar on air conditioning.
Okay.
Then after 3 days, we are having a webinar on legal issues in the COVID era to address all your legal questions.
Very nice. Then we should all attend that or attend these.
And we have weekly webinars on COVID on various aspects. Like this week, we had on sudden death.
Right, sir. So we will keep posting this information to all the members so that they can attend.
Yeah.
Then one last question, because we are coming to the end of discussion because we have 3 talks after this. One last question is, one member has asked if a doctor has fever and cough, can he refuse to see a patient?
Yes, he can refuse, and he should immediately seek redressal from the civil authorities to go and see the patient, to go and check himself.
Okay, okay. So thank you, sir. Yeah, Dr. Jain, you wanted to say something? Yeah, Dr. Jain?
Mute. His mic is mute.
Mic is, you can make it unmute.
Yes. डॉक्टर राजन सर,
हाँ जी बोलो सर.
ये पैंडेमिक एक्ट की कॉपी क्या हमें यूपी के लिए मिल सकती है सर?
सर वेबसाइट पे जाओ, यूपी की निकालो.
यूपी का डिजास्टर एक्ट है सर, डिजास्टर एक्ट मैं भेज दूंगा आपके पास.
एपिडेमिक एक्ट भी है. अगर नहीं है तो सेंट्रल एक्ट जो एपिडेमिक एक्ट है वो बाइंडिंग है ऑल ओवर द कंट्री.
तो अशोक
लीगली आल्सो.
अशोक राय सर, 1 मिनट, थोड़ा समय सब लोग हैं, इसलिए अयोध्या वाले लोगों को क्या आगे क्या गाइडलाइन दी जाए सर?
इसमें
अयोध्या वाले केस में
अयोध्या वाले केस में एक स्ट्रिक्ट लेटर शुड बी रिटन टू द हेल्थ मिनिस्टर ऑफ उत्तर प्रदेश और प्रिंसिपल कॉपी टू प्रिंसिपल सेक्रेटरी.
Chief Minister also.
दूसरा हम एक बता
Copy
सर
to
हम
Chief
एक
Minister also.
Copy to Chief Minister also. Yes.
मैं एक राजन शर्मा सर और अशोक राय सर को भी बता रहा था, सब लोग सुन ले कि एक बड़ा अच्छा लेटर मेरठ ने लिखा है अभी हेल्थ मिनिस्टर साहब को और डॉक्टर श्रीकांत शर्मा और चीफ मिनिस्टर को. मैं उसकी कॉपी करके और उसे भेज रहा हूँ आज हेल्थ मिनिस्टर, चीफ मिनिस्टर एंड प्राइम मिनिस्टर को.
ओके.
उसमें साफ साफ लिखा हुआ है कि ये बुलिंग बंद करें, हड़काना बंद करें.
वो जरा लेटर आप जयंत हमको भेज दीजिएगा. जयंत वो लेटर हमारे
मैं आपको भेजता हूँ सर.
हाँ, then I'll see.
मैं बना के पहले फिर उसको आपको भेज देता हूँ.
Sure.
Okay, so thank you to all the panel for this wonderful discussion. Lot of questions answered. There are still a lot of more coming up, so we will take them in the next webinar. Thank you, Dr. Rajan sir.
Thank you so much.
Thank you, Dr. Noida.
But whoever has time, we would want you to continue to hear our talks. We have some very interesting talks now. So the first talk is by our very
I'll take your leave, please.
Thank you, sir. Thank you so much.
Thank you, sir.
Thank you, sir.
Thank you, dear.
The first talk is on hospital workflow by a very young and very dynamic treasurer who is running his own hospital, and so he is one of the best persons to talk about hospital workflow. So please, Dr. Naman Sharma.
Good afternoon, everyone. I'll be just sharing the screen and then I'll begin the talk. So today I'll be speaking on the hospital workflow in COVID times. Can everyone see the screen, please?
Yes.
Yes, we can.
Perfect.
Dr. Mohita, I am having some important piece of work in hospital, so can I take your leave, Mayor Dr. Alok?
Yeah, sure. Thank you.
Yeah, sure, sir. Sure.
Thank you. Thank you very much. Thank you, Ashok sir.
Okay,
Thank you,
thank you,
Sharma sir.
thank
Thank
you.
you so much. And thank you, Naman. Thank you, Dr. Mohita. Namaskar.
Thank you.
Thank you.
Dr. N.K. Sharma nahi hai.
Okay, so hospital workflow in COVID times. So basically we informed on the telephone appointments callers that the emergencies would be taken until the lockdown is lifted. No regular cases would be taken and non-emergency patients would be seen later on. We have to space appointments 4 per hour. Gently ask the patient about the symptoms of fever, cough, breathlessness. Send a WhatsApp message clearly informing them of the etiquettes of the OPD in the hospital they are visiting. Only one attendant to be allowed and avoid bringing less patients attending to the hospital. Please do not bring your children to the hospital. Patients and attendants should be preferably be wearing a mask. If they're carrying a soiled mask from home, they should be given a new mask. Do not bring the old files, avoid cash payments, and bring their own pen and minimal personal belongings so that there is no chance of infection to the hospital. Screening desk is cordoned off from the waiting area and a new disposable mask is given. We have to check the body temperature and fill out the log form. We have to fill out the questionnaire and declaration form should be filled out by the patient himself or the attendant and to be dropped at the desk on the screening desk. This is a sample of the declaration screening form that we have made for our hospital. So we have to ask the patient about the brief history of symptoms, cardinal signs being fever, cough, sneezing, sore throat, fatigue, any myalgias or fever or body aches. So we have to ask about any history of travel to the hotspots or foreign travel. We have to ask about chronic illnesses, diabetes, hypertension, asthma, lung diseases, COPD, any history of epilepsy. Also, we need to ask about if the patient has been in contact with some COVID patient recently or has been involved into the active care of a COVID patient. So these things needs to be written down on a declaration form by the patient himself, and this needs to be dropped into the tray. If the patient has the patient needs to understand that this illness has a long incubation period and may remain asymptomatic, as we are seeing about 70% of patients are asymptomatic these days. So it is very difficult to tell which patient may turn out to be symptomatic later on. So we need a clear declaration form filled by the patient and inform him or her that there is a possibility of a legal action if the patient is hiding the information deliberately. This is the COVID-19 patient consent form that we have specifically made for our hospital. This one is a consent form and undertaking form that has to be filled by the staff. Some staff members have been found out to be alleging the hospital of getting the infection to their families, getting the infection spread around because of the patients that are visiting the hospital. So this needs to be filled by the hospital staff as well. Registration desk SOPs inform they have to fill the form, minimal one patient attendant only for vulnerable cases. Hand wash is a must at the main entrance. Mask should be donned, and there should be no touching of the patient. This desk should not be touched, and it should be cordoned off by a barrier. We should avoid cash payments, and if it is a high-risk patient, febrile or COVID symptoms are present, attendant needs to fill the form, which should be checked by the staff members whether all things have been mentioned as no. SOPs for waiting areas, it should be as empty as possible, reduce the waiting time. 2 chairs, single chair should be with a 2 meter spacing, bright tape should be put on, and we have to put stickers and tokens on chairs so that patients are knowing clearly whether they have to sit on, which chair they do have to sit on. And there should be no magazines and nothing, no reading material should be kept there. Patients' education posters are a welcome sign. So these are the waiting areas that we have designed worldwide. This is approved. So we can clearly see 2 people should not sit in between, and there should be a space of at least 1 to 1.5 meters in between them, depending on your waiting area. Triage 0 is the first position at the entry of the hospital where all patients entering the hospital are screened for fever. If there is a patient who is screened with fever, and he should be shifted to triage 1. A well-ventilated area should be the triage area. The triage 1 would be isolated from the main hospital. You have to ask about the flu symptoms. Check for the clinical records. If confirmed, then they should be directed to triage 2. And again, this place should be a ventilated area, and a large table to keep the documents between the patient and the person maintaining the triage should be kept. So when we enter the triage 2, this is the first place when they will see a doctor who will see the signs and symptoms, and the first physical examination about the saturation, NIBP, the temperature and other things would be done. So this is the place where we have to determine whether the patient himself or herself is a suspect, a stable one, or unstable suspect. So if there are suspected patients but they are stable, we have to send them to isolated rooms and the hospital quarantine until the sample reports are out. And if there are patients who are unstable, then we have to shift them to the COVID ICU in the resuscitation bay. Samples would be sent and to be reported as soon as the confirmation is done within 24 to 48 hours. So who needs isolation? All confirmed cases of COVID-19 are suspects, all suspected cases, any healthcare workers with symptoms directly involved in the treatment of COVID-19 patients, or those who have had a contact with one who is treating COVID-19 cases. Where do you isolate these patients? Any patient who is asymptomatic can be quarantined at the home, and symptomatic patients should be preferably quarantined or preferably kept in the hospital isolation rooms, and this should be closely monitored by a medical team. There have been instances where patients have been running out unmonitored, so this is very important that a medical team and the administrative team should monitor the place where the isolation wards are maintained. So it includes observation ward area, isolation wards, and isolation ICU area for this unstable patients. Negative pressure rooms are preferred over the normal ones, and this access should be strictly limited to only the medical staff. The layout would be having 5 zones and 5 passages. 5 zones would be the clean zone, the contaminated zone, potentially contaminated zone, 2 buffer zones between the clean zone and the potentially contaminated zone. So 5 passages are suggested for strict one-way movement. We should not allow two-way movements even if it is like staff. So staff entry and staff exit, patient entry and patient exit, and the biomedical waste exit. The storage and sampling, handling of the samples is very important. The samples are transported in a virus transport medium, then it is packed properly, and in a leak-proof container filled with cool packs, and then it is transported to the nearest lab or wherever the testing is taking place in your specific district. So what do we make sure to restrict the entry of doctors and staff if they're coming to the hospital and are involved in COVID care? So no one with symptoms of flu are allowed at the workplace. Record temperature and logbook. Minimal personal belongings are to be allowed. Short hair, nail, no rings, no watches. We have to change to the hospital dress as soon as we reach the hospital. We have to wash our hands as guided by WHO, and then wear a PPE cap, then wear a mask, goggles and face shield at the end, and then we can enter the main patient area. This is for the doctors and the staff both. The exit protocol says that we have to remove the clinical footwear, then change to our own. We have to go to the extension area where the donning and offing is done. So we have to remove the gown, the PPE kit, jumpsuit, caps, goggles, and remove the mask at the end. The disposal is to be done in an appropriate bin according to the biomedical waste guidelines. So we have to change to the hospital, from the hospital outfit to your normal outfit, and change. Post change, you have to wash hands, face, and if separate washroom is available for you, you can take bath. That's okay. Collect all your personal items and maintain a temperature check, and that should be maintained in a logbook. When you reach home, it is good to take bath. So what is the protocol for cleaning? Cleaning of materials which contain metals and delicate instruments are to be cleaned with 70% ethyl alcohol. Chairs also in the waiting area, the armrest, the headrest should be cleaned every 2 hourly. 1% freshly prepared sodium hypochlorite solution for non-metal things. Clean floors with 1% sodium hypochlorite solution, preferably 2 hourly if the hospital is a very crowded one. Start from corners and we have to proceed towards the door. High touch areas where the patients are frequently visiting or opening or touching entry doors, lockers, knobs, handles, even your lift buttons and light switches. Railings need to be cleaned by 1% hypochlorite solution at least 4 times a day. We have to clean the wheelchairs with hypochlorite solution, which is adequate, and do fogging of the entire hospital on a weekly basis. If the hospital is found to have a patient with COVID-19, then it is preferable that we put a barrier and we seclude that area in a different zone, and then we do not use that zone, and basically it is sort of a local sealing of the place. The cleaning agents are available in different solutions. This table shows what solution and what concentration is available, and we can create our own hypochlorite 1% solution according to the available solution in your area. In case of deceased patient or a dead patient, we have to remove all the tubes, drains and catheters. We have to dress with impermeable material, and any puncture holes or wounds should be disinfected with 1% hypochlorite. Plug all the oral and nasal orifices of the dead body to prevent leakage of body fluids, and place the body in a leak-proof plastic bag. Exterior of the body can be decontaminated with 1% hypochlorite solution. Provide the counseling to the family members and be empathetic, show some sympathy and be empathetic to their family members. Thank you for your patience. Thank you
so much, Dr. Naman. That was very comprehensive, and in fact some members are requesting, and so I think we should do that. We should an SOP and we should compile all that you have written, compile this and give it to all the members, so that they can start following everything. Many of us are already following, but so that we do not miss out on any points.
Sure. Thank you.
Now we go to a very important topic, which is related to treatment. Everybody has been asking, is there a treatment for COVID, and do we expect anything in future? So Dr. Shobhit Bansal, he will answer all these queries in his talk on treatment modalities. Can you introduce yourself, Dr. Shobhit?
Thank you very much, ma'am. I'm Dr. Shobhit. I'm working as a pulmonologist in Noida, and today I'll be giving a brief introduction of the topic and also would be taking few questions. And am I audible to everybody? Is it clear? Voice is coming clear? Okay. So I'll share my PPT for everyone to see. Okay. Is it visible? So we'll be discussing treatment modalities. All the respected dignitaries and esteemed viewers, a warm welcome to all of you. At the outset, I would like to begin by saying that together we can, and definitely together we will. The first and the foremost important point in treatment is no treatment, a condition where no treatment is required, and that is prevention. So everybody should follow all the guidelines, keep your hands, extremities sanitized, your mouth covered with masks, and follow all guidelines in such a manner that you can get infected. The chances of getting infected is as least as possible, and which could be which is the best scenario. Because as we know that it's a disease which is new to all of us. It's a recent onset pandemic. People are, even the doctors are battling to find the cure for it. So the best medicine to this disease is prevention. But then in case the person gets infected, then what we do? First we should know is what is the diagnosis confirmed? So in that condition, there is a suspected case and then there is a confirmed case. What is a suspected case? A suspected case is a person who has a sudden onset respiratory onset of cough, fever and shortness of breath with no other etiology that fully explains the clinical presentation, and with a history of travel or residence in a country or area which has evidence of community transmission during the last 14 days. Or a person with acute respiratory symptom and is in a close contact with a person which has symptoms. Or even though the person has no close contact but has features of severe acute respiratory infection, those patients can also be considered as the suspected case. And what is a confirmed case? Confirmed case are the ones which are laboratory confirmed, irrespective of signs and symptoms. Maybe the patient, irrespective of signs and symptoms means the patient may have some, because majority of patients are asymptomatic. How the cases are confirmed? The cases are confirmed through RT-PCR test, and results are available within 2 days. In this, a particular sequence of SARS coronavirus 2 gene is targeted. When it comes up in the secretion, then it's a confirmed case. Now, what are the once the person comes to a doctor, then routine investigations are being done. Out of which, first is routine WBC. Counts can vary; they can be high, they can be normal, they can be low. But mostly it is lymphopenia has been reported. Mild thrombocytopenia is also seen. Then if the doctors wish, or if the facilities are available, then serum prolactin and CRP can also be done. Serum prolactin is often normal and CRP levels are higher. What are the radiography and CT findings in chest radiographs? In asymptomatic patients or mild patients, there could be no evidence of pneumonia, but in case of moderate to severe patients, there are infiltrates. CT findings, computer tomography or CT is generally done in moderate to severe cases. It has various stages. Early stage, there are fluffy ground glass opacities. In progressive and peak stage, the densities become more dense, more confluent. They're bigger in size, involving a larger portion of the lungs, and leads to more morbidity. Once the patient starts improving, there is an absorption stage where these opacities gradually resolve. Now, since we are discussing treatment, we should know that majority cases are asymptomatic, and the treatment for those cases is home quarantine. even if you are staying at home, make sure that you don't transmit your infection to to the people living at your with your family members. In a manner that you keep your hands clean, you keep your surroundings clean, use face mask, keep separate set of utensils, and whatever best could be done to prevent infection at home. Then out of the symptomatic patients, there are 80% patients who are mildly sick. Now, in mild sick, what are the features which with which the patients present is mild sore throat, there could be mild grade fever, there is running nose, there is weakness, there could be mild headache. And all these symptoms are not very worrisome. But still, if you have mild illness, you may visit your doctor, take proper precautions. And the treatment for mild illness mainly consists of adequate hydration, paracetamol if you have fever, adequate diet, and mild cetirizine or fexofenadine in case the running nose or the cough or the sore throat is bothersome. So this happens, mild illness happens in 80% cases, then resolves spontaneously within 7 to 14 days. Moderate illness occurs in around 10 to 15% cases. Now, once the person is diagnosed as COVID with moderate illness, he has to be hospitalized. Proper hospital care, so that if the patient lands into a severe or life-threatening condition, there are facilities available around him. How does the patient present with moderate illness? Apart from having cough, rhinorrhea, that is discharge from the nose, mild to moderate grade fever, patient will start to have dyspnea. Dyspnea means he'll start to feel difficulty in breathing. At this point, when a chest X-ray is done in the hospital, it shows definitive infiltrates, and if followed by CT, the diagnosis can be surely confirmed. In hospital, the patient has to be kept in the quarantine ward, has to be given supportive care in the form of adequate hydration by IV fluids, supportive antibiotic care, oxygen supplementation at very low level if it is required. At this point, apart from routine medications, we can also start dedicated medications like oseltamivir, which is an antiviral drug. Some centers are giving trials which are giving good results. Considering hydroxychloroquine and other antiviral drugs, which are antiretroviral, mainly lopinavir and ritonavir. The doses are given, which are to be given, are mentioned everywhere, and doctors can definitely find them. Then, when a person suffers from moderate illness, utmost care has to be taken. Majority of patients, that is 15% of patients, will slowly improve from moderate illness to recuperation. But utmost care has to be taken that person does not progress. And now, at this moment, it totally depends on the expertise of the doctor that the patient should not progress to moderate illness. There could be scenario the patient progress, then we have other facilities at our hand to prevent further morbidity. In case the person goes into critical illness, now we know that the patient has moderate illness, he is in a hospital, and now he progresses to critical illness. How we know the patient has landed into critical stage? The oxygenation will worsen. The oxygen demand would increase. The symptoms would worsen in the form that patient would have more cough with a lot of expectoration, that is, a lot of secretions coming out of the mouth, a lot of secretions coming out of the nose, high-grade fever, difficulty in breathing, may also have loss of appetite, abdominal discomfort, and features of multi-organ failure like deranged liver function test, deranged renal function test, deranged cardiac function test, and the patient may be getting hemodynamically unstable, cardiac changes. So at this moment, it is totally onto the expertise of the intensivist who is looking after him in the ICU. He may be, along with the supportive treatment, high-end antibiotics, then the latest drugs which are we have kept on trial can also be used. out of which one is remdesivir. This is a newer generation antiviral drug, has been used at many centers, doses as per the symptoms, and has definitely given good results. We need to continue with IV antibiotics, supportive care, and in case the patient worsens further, intubating and putting on mechanical ventilation should not be delayed. Mechanical ventilation and intubation buys us a lot of time so that the patient's body can rest. We can give adequate antibiotics, and whatever drugs are available, which are to be used, can be adequately utilized. Last but not the least, a newer therapy in the form of transfusion of convalescent plasma has also been used at some centers. The ICMR is giving approval. At a lot of other centers, this theory has given very promising result. In this, fresh plasma from the patients who have recovered is taken and is infused or transfused in increasing doses. Initially, we give low dose, see the result. There is no reaction. Then we, if there is no reaction, then we give higher doses and then further higher doses. And we monitor the vitals and do repeated X-ray scans and CT scans to see if the symptoms and features of coronavirus, they start decreasing. So a lot of things are going in the world. A lot of treatment modalities are upcoming. But at this moment, we should always keep one thing in mind, that nothing is better than prevention. So all of us should take care of ourselves in the form to regularly sanitize our hand and use face mask whenever we are moving out of our homes. And finally, one thing is there, that the role of NIV, the non-invasive ventilation. Some centers are using it, but generally it has a limited role because it spreads infection more than it contains it. I would like to end my talk here, and if any further questions are there, they are most welcome. Thank you, ma'am. Thank you, everyone. Ma'am, we can't hear you.
Audible.
Thank you so much, Dr. Shobit. Very comprehensive talk, telling us all about the different treatments and in different stages of the disease. Now, one question before I go on to my next talk is, how promising is this convalescent plasma therapy? Because there was a lot of hue and cry about it.
No, it is definitely very promising, and not only in this condition. In future, if we suffer any sort of viral pandemic, in future also, this is a very promising therapy. Why? Because it's a definitive thing that once antibody is made in someone's body against coronavirus, these antibodies will definitely go in some other person's body also to kill coronavirus. This is for sure a very definitive treatment. This is also called as giving active immunity. There is a passive immunity, we give injection and the immunity develops later on. But this is, we are genuinely giving active immunity to a person to fight it. So it is a very promising result, not only for coronavirus, but also for other viral infections.
So we have some hope. And I was reading somewhere that now DCGI has given an approval to ICMR for a clinical trial on some more than 200 patients for this convalescent plasma therapy, and probably then, and this is a fast track trial, so as soon as the results are there, then probably we would have at least one treatment for protection.
Definitive treatment, yes, definitely.
And one more question, because about this antibody test, now is it there, it is on, or is it banned by the government?
It is on hold for some time. It's not like that. Sometimes what happens is that antibodies take some time to appear. Initially, the infection appears in the form that there is a huge viral load in the body, and antibodies are very less, which are used in killing the virus. So the antibody test comes positive after a few days. So they have kept the antibody test on hold for 2-3 days, and then they would repeat it. And we are sure that it is not a test which we need to discontinue. We need to continue it. We need to reassess it again, and definitely positive results will come. we cannot trash it like that.
Fine, thank you so much. So now we will go on to the next talk, and I will be talking about telemedicine. So telemedicine is definitely the need of the hour. Now, in these current times where there is a pandemic, where there is a lockdown, and where there is so much of stress on social distancing, telemedicine is the only answer which will bring about a safety of our healthcare workers and the doctors as well as patients. Once the lockdown is lifted, then it is not that the day the lockdown is lifted, the corona also goes away. Once the lockdown is lifted, there is a chance that there will be an exponential increase in the number of cases if social distancing is not followed. So once the lockdown is lifted, there the role of telemedicine becomes even more, because then also we have to follow social distancing and we have to tell our patients to come only if needed. And whatever can be solved on telemedicine has to be solved on telemedicine. Now, government has also given approvals for telemedicine, and recently, as you all must have heard, government has launched this Arogya Setu app, and within 2 days, on the call of our Prime Minister, 20 million people have installed this app. Now, apart from lockdown and pandemics and disasters, if you see the times which are, for example, our pre-corona times, there also telemedicine has a role because of three things. Firstly, it gives a timely treatment. Secondly, it will it is a means of treatment even from the areas which are inaccessible to doctors, for example, the rural areas or say hilly areas. And thirdly, it is something which will save the travel cost, time, as well as effort. So these are the advantages of telemedicine, and telemedicine hence is not just for pandemics and lockdown, but it is something which is going to stay, and this is something which we need to adopt. Now, this was already approved by Indian Medical Council, but on 25th March 2020, in view of all the corona pandemic, NITI Aayog came up with some new guidelines for telemedicine, and whatever telemedicine we follow, we should see that we should see to it that we follow all the guidelines. Now, there are some courses which are also coming up on registered medical practitioners over the next 3 years. But in this interim period, as per the government, we can do telemedicine even without doing these courses. But in the period of 3 years, we will have to do these courses. Now, there are certain exclusions in telemedicine. First is research and evaluation. This should not be done with telemedicine as per guidelines. Secondly, continuing education of healthcare workers cannot be done by telemedicine. And thirdly, international patients cannot be dealt with in telemedicine. There are various modes of communication with telemedicine. These include the audio mode, the video mode, and the text mode. And these are there are several tools for telemedicine. A simple call which a doctor does with a patient is also a tool for telemedicine. Apart from this, there can be other tools, like there can be Skype, there can be Zoom, there can be Messenger, there can be mail. But the best tool is the one in which there is a dedicated telemedicine app, because if there is a dedicated telemedicine app which is following all the guidelines, then we are not only safe, but we are able to give a proper treatment to our patients. In telemedicine, the consultation can be either an emergency consultation or it can be a non-emergency consultation. In non-emergency, it can be for new patients or for our patients which are already our old patients and need a follow-up treatment. The important thing about telemedicine is that it brings all the important people together, which includes the RMP, the caregiver, the patient, as well as the healthcare workers. So everybody can come on one single platform. Now, one important caution about telemedicine is that only safe medicines should be prescribed. Medicines like anti-cancers, etc., or immunosuppressants should not be prescribed, because you never know what the side effects may be. Another very, very important point is that ethics and privacy have to be maintained. So whatever telemedicine tool you are using, you should see to it that you maintain all the ethics and privacy, you maintain all the privacy and confidentiality. However, if there is a telemedicine app, because of which there is a breach in privacy and confidentiality, as per the guidelines, the registered medical practitioner is not taken as liable. So as I said, these are the various tools for telemedicine. So we have been researching on several tools for the last 1 month because in this era, telemedicine is a need. And we researched on several apps, and we came down to one app for which I would like to show you a short demo on how we are doing it. Now, but before I show you the demo, these are the features which should be there in an ideal app. First of all, it should be a personalized app. Now, the importance of having a personalized app is that you are not sitting on a platform where there are several doctors there. Because if there are several doctors there, if the patient does not find, if patient is not able to contact you, they would go to the next, and if they are not able to contact that doctor, they would go to the next one. And many times in our telemedicine apps, we give all our data. So we may not like to share all our data with everybody. Then secondly, also we are discouraging rating of doctors. Now there are many platforms where you will find that doctors are rated as 1+ or 2+ or 3+ or 5+ stars. So this is a practice which should be discouraged, because when a patient is rating a doctor, he or she is not rating just the doctor, but they are also rating the services. For example, they may give a 1 star based on the fact that they had a longer waiting time, or they may just write that it is never go to that clinic or hospital because the front desk was rude. So whenever they are rating like this, they are actually not rating your competence, but they are rating your whole service. So it is better that we avoid platforms where there is a rating happening openly in the public. Rather, we should have a platform where the patient can give his or her own feedback to us, and we can improve based on that feedback. So if we have a personalized app, we can have a platform where the feedback can be given only to us. Secondly, the most important thing about telemedicine is that the app should be such that it is easy to do, because the biggest hitch in every doctor's mind and every patient's mind is that would I be able to use this app? So if the technology is easy to do and technology is doing most of the things and the doctor is free to just give the consultation on that, this becomes an ideal app. Thirdly, the privacy and patient confidentiality has to be maintained. Fourthly, there should be an option of consent within your app as per the guidelines. You should be able to, the patient should be able to upload the previous records, and there should be a facility of linking it with your own EMR. All modes of communication, whether audio or video, should be possible. There should be a possibility of appointment scheduling, so that the doctor can schedule as per the timings that the doctor is available. For example, he or she may be available from 10 to 12 in the morning and 5 to 7 in the evening. So they are not disturbed the whole day. And along with this, there can be a possibility of emergency appointments for any emergency situation. There should be an option to consult multiple doctors. This is applicable for clinics which have multiple doctors or hospitals which have multiple doctors. There should be option for notifications, call reminders, and automated messages. Then there are solutions where more than one person can join in, so that the family may be able to join in. For example, the mother is sitting here in Noida and the son is sitting somewhere in London, then both should be able to join in into the consultation so that they can take a combined decision. There should be an option to upload the prescription. Then there are certain apps where there is an option of progression monitoring, which means, for example, in the case of pediatrics, if the birth weight has to be monitored, so the app should, as soon as the patient's data opens up, the app should also be showing as to how the birth weight is progressing, so that not just the doctor, the patient is able to also assess this as to how the progress is happening. Then there should be an option of research on your own treatment modality. There are some technologies where you can actually check out and on a particular treatment that you have been given as to how effective that treatment is in your hands. And lastly, there should be a payment gateway. We all have been doing mostly free treatments in this current era, but ultimately we have to go on to paid services. So there should be a payment gateway. And this becomes an advantage with any dedicated app, because on our phone calls, on our WhatsApp, we are giving free treatments. So based on all these features, we need to find an ideal solution. I will show you one of such technologies, and I would request you to go back and check on various technologies and find your ideal solution. And if you want any help from us, we can do that. So just a few more points. Whenever you're doing a teleconsultation, your communication has to be clear, and it should be as close to an in-person consultation as possible. Your communication should be a formal consultation. So whatever words you use, how you are dressed up, all that is also important, just like it is in your own clinic. You should have the previous records if it's a follow-up patient. You should avoid any possible delays, because this puts off the patient and puts off the patient. There should be no proxy consultations allowed except for minors and incapacitated. No anonymous calls should be taken. There should be no teleconsultations done for medical legal cases, and if you want, there should be an option of extending the duration of the call. So showing a demo of an app. This is an app which we are using. Now, whenever a call comes from a patient to our helpline, our front desk person will add this patient to the app. Now, when he adds the patient, Now, for adding the patient, either he can send a Google form to the number of the patient, to the mobile of the patient, or he can fill it up himself. The data that is needed is the name, gender, and date of birth. Apart from this, other data can also be filled in. Now, when this data is filled in the Google form, this is taken as an implied consent. So a separate consent form is not needed. Now, as soon as this is filled, the username and password goes to the patient's mobile, and a message goes to on an SMS message. Now, after this, the patient is asked to download the app from Google Play. And once the app is downloaded, this is what it looks like. Following this, the patient can book an appointment. There is an option, as you can see, of a scheduled appointment as well as an emergency appointment. Now, as soon as the patient books an appointment, there is an option that he's asked for an option of a video call or a audio call, and they can book according to what they want. And as you can see on the right side, this is the schedule which the doctor has put, so the patient can book as per the schedule on which the doctor is available. Now, as soon as this happens, a token goes to the patient and a message goes to the patient telling the patient that the appointment is confirmed. And 5 minutes before the scheduled appointment, a message again goes to the patient reminding the patient that the appointment time is about to come, and the patient should be ready with his mobile or laptop, whatever is available. Then a schedule also goes to the doctor. On the doctor's laptop, there will be an appointment schedule, so that the doctor knows when the appointment is. And once the call reminder went to the patient calls, and this is how a video consultation is done. Now, the importance of video consultation is that there is a one-to-one connect with the patient, and hence there is a better understanding of the problem, and a better treatment can be given compared to an audio consultation. And when the consultation is over, then there is a option for payment. Now, in the option for payment, you can actually fill up whatever you want your fees to be, but there is also an option for waiving the fees or for decreasing or increasing the payment as per whatever the consultation is, and then an invoice is generated. Now, this is for a patient who's not your own patient and has contacted for the first time. But if you have your own database, you can actually feed everything already into your database, so that whenever the patient contacts, you can search based on the QR code, MRD number, or the phone number, and a similar consultation can be done. So this is showing how the doctor schedules their own appointments, so that the patient can contact in those appointments. There are also options of drug master, investigation master, advice master, and payment master. So you can fill it up in advance, so that at that time you don't have to fill up all the details. You can just choose whatever is already there in the app. So finally, a good app is the one which makes your clinic qualitatively, quantitatively, and revenue-wise good, and helps you evolving into a better clinic. And the doctor's role in all these consultations should be minimal. which means that whatever the patient or caregiver cannot do, technology should do. Whatever technology cannot do, front office should do. In fact, the front office role also becomes minimal in this, because everything the technology is doing, all that the front office is doing is giving some push messages, etc., and some notifications if needed. Only what all these cannot do, that is giving consultations, is what doctor should do. And hence, then this becomes a very good telemedicine consultation. Thank you so much.
Thank you, ma'am. Thank you so much.
So we end this session now. I don't think we have any more questions, and we are over with the time also. Dr. N.K. Sharma, would you like to say something before we end?
He says everything is fine.
Everything is fine? Okay.
Yeah.
Okay, thank you so much everybody for attending this webinar, and thank you so much to our speakers, to our panelists for attending this, and a very big thank you also to Entod Pharma and their team, who were very efficient in making this happen. Thank you.
Thank you. Thank you so much, ma'am. Thank you, ma'am.
Thank you.
Thank you.